Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 NCLEX-RN nursing examination multiple choice questions and answers. Read the question by yourself.
406. A client has a prescription to receive valproic acid, dipakine 250 mg once daily. To maximize the client's safety, the nurse schedules administration of the medication, 1 with lunch, 2 with breakfast, 3 before breakfast, 4 at bedtime with a snack. Answer: 4. Rationale: valproic acid is an anticonvulsant that causes central nervous system, CNS, depression. For this reason, the side effects include sedation, dizziness, ataxia, and confusion. When the client is taking this medication as a single daily dose, administering it at bedtime negates the risk of injury from sedation and enhances client's safety. Otherwise it may be given after meals to avoid gastrointestinal upset. 407. A nurse is reading the history and physical examination of an older client admitted to the hospital. Which findings documented in the history place the client at risk for accidents? Select all that apply. 1. Range of motion is limited. 2. Peripheral vision is decreased. 3. The client denies complaints of nocturia. 4. Transmission of hot impulses is delayed. 5. High-frequency hearing tones are perceptible. 6. Voluntary and autonomic reflexes are slowed. Answer: 1, 2, 4, 6. Rationale: the physiologic changes that occur during the aging process increase the client's risk for accidents. Musculoskeletal changes include a decrease in muscle strength and function, lessened joint mobility, and limited range of motion. Nervous system changes include slowed voluntary and autonomic reflexes. Sensory changes include a decrease in peripheral vision and lens accommodation, delayed transmission of hot and cold impulses, and impaired hearing as high-frequency tones become less perceptible. Genitourinary changes may include nocturia. 408. A nurse has a prescription to obtain a sputum culture from a client admitted to the hospital with a diagnosis of pneumonia. The nurse should take which actions when obtaining the specimen? Select all that apply. 1. Explain the procedure to the client. 2. Obtain the specimen early in the morning. 3. Have the client brush his teeth before expectoration. 4. Instruct the client to take deep breaths before coughing. 5. Place the lid of the culture container face down on the bedside table. Answer: 1, 2, 3, 4. Rationale: the nurse always explains a procedure to a client. Placing the lid face down on the bedside table contaminates the lid and could result in inaccurate findings. The specimen is obtained early in the morning whenever possible, because increased amounts of sputum collect in the airways during sleep. The client should rinse the mouth or brush the teeth before specimen collection to avoid contaminating the specimen. The client should take deep breaths before expectoration for best sputum production. 410. A nurse is developing a hospital policy on guidelines for telephone and verbal prescriptions. Which of the following guidelines should the nurse include in the policy? Select all that apply. 1. The nurse should clarify questions with the physician. 2. The nurse should repeat the prescribed prescriptions back to the physician. 3. The use of abbreviations such as to, telephone order, is never acceptable. 4. Verbal prescriptions are never acceptable. The physician must document the prescription. 5. Co-signing the prescription by the physician is not necessary if the nurse repeats the prescription for verification. 6. The name of the physician giving the prescription does not need to be documented if the physician giving the prescription is the client's primary physician. Answer: 1, 2. Rationale: a telephone order, 2, involves a physician stating a prescribed therapy over the phone to a nurse. Telephone orders are frequently given at night or during an emergency and need to be given only when absolutely necessary. Likewise, a verbal order, VO, is acceptable when there is no opportunity for the physician to write the prescription, such as in an emergency situation. Additional guidelines for telephone and verbal prescriptions include the following: clearly determine the client's name, room number, and diagnosis. Repeat any prescribed prescriptions back to the physician. Use clarifying questions to avoid misunderstandings. Write to telephone order, ORVO, verbal order, including the date and time, name of the client, complete prescription, name of the physician giving the prescription, and nurse taking the prescription, and have the physician co-sign the prescription within the time frame designated by the healthcare agency, usually 24 hours. 411. A nurse employed in a preschool agency is planning a staff education program to prevent the spread of an outbreak of an intestinal parasitic disease. The nurse includes which priority prevention measure in the educational session? 1. All food will be cooked before eating. 2. Only bottled water will be used for drinking. 3. All oil eating areas will be cleansed daily with soap and water. 4. Staff will practice standard precautions when changing diapers and assisting children with toileting. Answer: 4. Rationale: the fecal-oral route is the mode of transmission of an intestinal parasitic disease. Standard precautions prevent the transmission of infection. Some fresh foods do not need to be cooked as long as they are washed well and were not grown in soil contaminated with human feces. Water and fresh foods can be vehicles for transmission, but municipal water sources are usually safe. Cleaning with soap and water is not as effective as the use of bleach. 412. A client has arrived at the labor and delivery unit in active labor. The nursing assessment reveals a history of recurrent genital herpes and the presence of lesions in the genital tract. The nurse plans to: 1. Prepare the client for a cesarean delivery. 2. Limit visitors and maintain reverse isolation. 3. Prepare the client for a spontaneous vaginal delivery. 4. Rupture the membranes artificially, looking for meconium-stained fluid. Answer: 1. Rationale: a cesarean delivery can reduce the risk of neonatal infection with a mother in labor who has herpetic genital tract lesions. There is no need to limit visitors or maintain isolation, although standard precautions should be maintained. Intact membranes provide another barrier to transmitting the disease to the neonate. A vaginal delivery presents a risk of transmitting the disease to the neonate. 413. The nurse prepares to insert an indwelling Foley catheter into a client. To maintain the integrity of the Foley catheter and client safety, the nurse should do which of the following? Select all that apply. 1. Use strict aseptic technique. 2. Place the drainage bag lower than the bladder level. 3. Advance the catheter after urine appears in the tubing. 4. Inflate the balloon with 4 to 5 milliliters beyond its capacity. 5. Test the balloon for patency before catheter insertion. Answer: 1, 2, 3, 5. Rationale: the nurse risks rupturing the catheter's balloon by overinflating it, thus the nurse inflates the balloon with the specified volume for the catheter. Therefore inflating the balloon with 4 to 5 milliliters beyond its capacity is unsafe. The nurse would use strict aseptic technique to insert the catheter. The drainage bag is placed lower than bladder level to ensure drainage, prevent retrograde flow of urine, and reduce the risk of infection. Advancing the catheter 1 to 2 inches beyond the point where the flow of urine is first noted is also good practice because this ensures that the catheter balloon is completely in the bladder before it is inflated. Best practice is to test the patency of the balloon before insertion to verify its integrity and reduce the risk of infection. 414. A moderately depressed client who was admitted to the mental health unit 2 days ago suddenly begins smiling and reporting that the crisis is over. The client says to the nurse, "Call the doctor. I'm finally cured." The nurse interprets this behavior as a cue to modify the treatment plan by 1. Allowing off-unit privileges (PRN). 2. Suggesting a reduction of medication. 3. Allowing increased in-room activities. 4. Increasing the level of suicide precautions. Answer: 4. Rationale: a client who is moderately depressed and has only been hospitalized 2 days is unlikely to have such a dramatic cure. When a mood suddenly lifts, it is likely that the client may have made the decision to cause self-harm. Suicide precautions are necessary to keep the client safe. Therefore options 1, 2, and 3 are incorrect. 415. A nurse is planning care for a suicidal client. The nurse should implement additional precautions at which of the following times? 1 during the day shift. 2 on weekday evenings. 3 between 8 a.m. and 10 a.m. 4 during the unit shift change. Answer: 4. Rationale: at shift change, there is often less availability of staff. The psychiatric nurse and staff should increase precautions for suicidal clients at that time. Weekends are also high-risk times, not weekdays. The night shift also presents a high-risk time. 416. The nurse assists with the transfer of a female client from the operating room table to a stretcher. To maintain client safety, the nurse, select all that apply. 1 checks the client's level of consciousness. 2 checks wheel locks of the operating room table. 3 applies a safety belt to the client after the transfer. 4 completes the client transfer as quickly as possible. 5 tells the client to move self from the table to the stretcher. Answer: 1, 2, 3. Rationale: as part of a safe transfer of a client after a surgical procedure, the nurse should assess the client's level of consciousness and if appropriate let the client know that she will be transferred from the operating room table to the stretcher. The nurse checks the wheel locks of the table and the stretcher to prevent any movement during the transfer. In addition, the nurse secures the client after the transfer with a safety belt because safety belts can prevent the client from falling off the stretcher. This is important because the client is likely to be sedated and unable to protect herself from falling. The personnel avoid hurried movements and rapid changes in position because hurried movements predispose the client to hypertension. Besides, secure, deliberate movement increases the security of the client. Because the client remains affected by anesthesia, the client should not move herself. 417. A nurse is planning care for a hallucinating and delusional client who has been rescued from a suicide attempt. The nurse plans to 1. Check the client's location every 15 minutes. 2. Begin suicide precautions with 30-minute checks. 3. Initiate 1-to-1 suicide precautions immediately. 4. Ask the client to report suicidal thoughts immediately. Answer: 3. Rationale: 1-to-1 suicide precautions are required for the client rescued from a suicide attempt. In this situation, additional significant information is that the client is delusional and hallucinating. Both of these factors increase the risk of unpredictable behavior, decreased judgment, and the risk of suicide. Options 1, 2, and 4 do not provide the constant supervision necessary for this client. 418. A nurse is developing a plan of care for a client receiving anticoagulant agents. The nurse identifies which potential problem as a priority for this client. 1. Injury. 2. Fatigue. 3. Infection. 4. Dehydration. Answer: 1. Rationale: anticoagulant therapy predisposes the client to injury because of the agent's inhibitory effects on the body's normal blood clotting mechanism. Bruising, bleeding, and hemorrhage may occur in the course of activities of daily living and with other activities. Options 2, 3, and 4 are unrelated to this form of therapy. 419. A client being seen in the emergency department with complaints of abdominal pain has a diagnosis of acute abdominal syndrome and the cause has not been determined. The nurse would question a prescription for which of the following at this time? 1. Clear liquid diet only. 2. Insertion of a nasogastric tube. 3. Insertion of an intravenous, 4, line. 4. Administration of an analgesic, such as ketorolac, trometamine, Toradol. Answer: 1. Rationale: Until the cause of the acute abdominal syndrome is determined and a decision about the need for surgery is made, the nurse would question a prescription to give a clear liquid diet. The nurse can expect the client to be placed on NPO status and to have an IV line inserted. Insertion of a nasogastric tube may be helpful to provide decompression of the stomach. Pain management with medications that do not alter level of consciousness, for example, ketorolac, can decrease diffuse abdominal pain and rigidity, help with localizing the pain, and lead to more prompt diagnosis and treatment. 420. A family friend telephones the home health nurse to inquire if there is anything she can do, as a friend, to assist her neighbors, the parents of a newborn with congenital tracheoesophageal fistula. The parents had expressed nervousness about giving enteral feedings. The best nursing action is to 1. Inform the friend to directly contact the family and offer assistance to them. 2. Request that the friend come to the client's home, to be taught to administer the feedings. 3. Report the friend's telephone call to the nurse manager for referral to the client's social worker. 4. Inform the friend that the family has no need for assistance because the nurse is making daily visits. Answer. 1. Rationale. A nurse must uphold the client's rights and does not give any information regarding a client's care needs to anyone who is not directly involved in the client's care. To request that the friend come for teaching is a direct violation of the client's right to privacy. There is no information in the question to indicate that the family desires assistance from the friend. To refer the call to the nurse manager and social worker again assumes that the friend's assistance and involvement are desired by the family. Informing the friend that the nurse is visiting daily is providing information that is considered confidential. Option 1 directly refers the friend to the family. 421. The nurse has been assigned to care for a client recovering at home from a disabling lung infection. While obtaining a nursing history, the nurse learns that the infection is probably the result of human immunodeficiency virus, HIV. The nurse is morally opposed to homosexuality and cannot care for the client. The nurse then leaves the client's home. Which of the following is true regarding the nurse's actions? 1. The nurse has a legal right to inform the client of any barriers to providing care. 2. The nurse has the right to refuse to care for any client without justifying that refusal. 3. The nurse has a duty to protect self from client care situations that are morally repellent. 4. The nurse has a duty to provide competent care to assign clients in a non-discriminatory manner. Answer. 4. Rationale. The nurse has a duty to provide care to all clients in a non-discriminatory manner. Personal autonomy does not apply if it interferes with the rights of the client. There is no legal obligation to inform the client of the nurse's personal objections to the client. Refusal to provide care may be acceptable if that refusal does not put the client's safety at risk and the refusal is primarily associated with religious objections, not personal objection to lifestyle or medical diagnosis. The nurse also has an obligation to observe the principle of non-maleficence, neither causing nor allowing harm to befall the client. 422. A nurse is preparing to administer heparin sodium 5000 units subcutaneously. The nurse should take which action to safely administer the medication? 1. Inject via duct and infusion device. 2. Inject within 1 inch of the umbilicus. 3. Massage the injection site after administration. 4. Change the needle on the syringe after withdrawing the medication from the vial. Answer. 4. Rationale. The injection site is located in the abdominal fat layer. Heparin administered subcutaneously does not require an infusion device. It is not injected within 2 inches of the umbilicus or into any scar tissue. The needle is withdrawn rapidly, pressure is applied, and the area is not massaged. Injection sites are rotated. After withdrawal of heparin from the vial, the needle is changed before injection to prevent leakage of medication along the needle tract. 423. A client asks the nurse to act as a witness for an advance directive. Which is the best intervention for the nurse to implement? 1. Decline the client's request politely. 2. Agree to sign the document as a witness. 3. Help the client find an unrelated third party. 4. Notify the provider of the client's request. Answer. 3. Rationale. An advance directive addresses the withdrawal or withholding of life-sustaining interventions that can prolong life and identifies the person who will make care decisions if the client becomes incompetent. 2 people unrelated to the client witness the client's signature and then sign the document signifying that the client signed the advance directive authentically. Nurses or employees of a facility in which the client is receiving care and beneficiaries of the client should not serve as a witness because of conflict of interest concerns. There is no reason to call the provider unless the absence of the advance directive interferes with client care. 424. A home care nurse visits a 3-year-old child with chickenpox. The child's mother tells the nurse that the child keeps scratching the skin at night and asks the nurse what to do. The nurse tells the mother to 1. Place soft cotton gloves on the child's hands at night. 2. Apply generous amounts of a cortisone cream to prevent itching. 3. Give the child a glass of warm milk at bedtime to help the child to sleep. 4. Keep the child in a warm room at night and cover the child with blankets. Answer. 1. Rationale. Gloves will keep the child from scratching the open lesions from chickenpox. Generous amounts of any topical cream can lead to medication toxicity. Warm milk will have no effect on itching. A warm room and blankets will increase the child's skin temperature and make itching worse. 425. An older adult client has been identified as a victim of physical abuse. In planning care, the nurse places highest priority on 1. Obtaining treatment for the abusing family member. 2. Adhering to federal mandatory abuse reporting laws. 3. Notifying the caseworker to intervene in the family situation. 4. Removing the client from any situation that presents immediate danger. Answer. 4. Rationale. The priority nursing intervention is to remove the abused victim from the abusive environment. Options 1, 2, and 3 may be appropriate interventions but are not the priority. 426. A client diagnosed with leukemia asks the nurse questions about preparing a living will. The nurse informs the client that the best method of preparing this document is to 1. Talk to the hospital chaplain. 2. Obtain advice from an attorney. 3. Consult the American Cancer Society. 4. Discuss the request with the healthcare provider. Answer. 4. Rationale. Living wills are legal documents known as advance directives wherein the client delineates the withdrawal or withholding of treatment when the client is incompetent. It should not be confused with the will that bequeaths personal property and specifies other actions at the time of the client's death. The client starts the process of writing a living will by discussing treatment options and other related issues with the healthcare provider. As well, the client should discuss this issue with the family. Although options 1 and 2 may be helpful, contacting them is not the initial step because both professionals lack the medical information the client needs to make an informed decision. However, the lawyer may be involved after discussion with the healthcare provider and family. The American Cancer Society may have pertinent information on living wills, however, the information is not individualized to the client's needs. 428. A client with a subarachnoid hemorrhage secondary to ruptured cerebral aneurysm has been placed on aneurysm precautions. To provide a safe environment, the nurse ensures that the client is provided with which of the following? 1. Bright lights. 2 enemas as needed. 3. Television and radio. 4. Daily stool softeners. Answer. 4. Rationale. Aneurysm precautions include a variety of measures designed to decrease stimuli that could increase the client's intracranial pressure. These include instituting dim lighting and reducing environmental noise and stimuli. Enemas should be avoided, but stool softeners should be provided. Straining at stool is contraindicated because it increases intracranial pressure. 429. A nurse is about to administer an intravenous dose of torbramycin, Torb-Rex, when the client complains of vertigo and ringing in the ears. The nurse should, 1. Hold the dose and call the physician. 2. Check the client's pupillary responses. 3. Hang the dose of medication immediately. 4. Give a dose of droperidol, inapsine, with the torbramycin. Answer: 1. Rationale: torbramycin, Torb-Rex, is an antibiotic, aminoglycoside. Ringing in the ears and vertigo are 2 symptoms that may indicate dysfunction of the 8th cranial nerve. Ototoxicity is a toxic effect of therapy with aminoglycosides and could result in permanent hearing loss. The nurse should hold the dose and notify the physician. Options 2, 3, and 4 are incorrect nursing actions. 430. A nurse is preparing to administer amiodarone, cortisone, intravenously. To provide a safe environment, the nurse ensures that which specific item is in place for the client before administering the medication. 1. Oxygen therapy. 2. Oxygen saturation monitor. 3. Continuous cardiac monitoring. 4. Non-invasive blood pressure cuff. Answer: 3. Rationale: amiodarone is an antidysrhythmic used to treat life-threatening ventricular dysrhythmias. The client should have continuous cardiac monitoring in place, and the medication should be infused by intravenous pump. Although options 1, 2, and 4 may be in place for the client, they are not specific items needed for the administration of this medication.